physical activity is part of life, especially after a transplant. And we need to talk about it more. And I think that I'm really eager for us to be involved in spreading that message and advocating that physical activity is so important after a transplant and that you can get active again. My name's Nicola Gray and I'm a physiotherapist at Westmead Children's Hospital. Physical activity is essential in your recovery from a transplant, in the journey back to living an active life. It's so essential to avoid other health risks, and just like everyone else, it's so important for your physical and mental health, and it's important for your quality of life. The rehabilitation following a transplant is a process, and we do start slow and gentle. And for example, in the hospital setting, physiotherapists like myself will come and visit you, and it might be as simple as sitting you on the edge of the bed. And we teach you how to move to be safe and to avoid discomfort. It may be challenging, but that's why we start slow and we support you each step of the way. We then might progress to sitting out of bed in a chair or trying to do a little walk in your room. And then throughout that hospital stay, we might be aiming to walk a little bit further down the corridor, or even walking up and down the stairs is a big achievement in that first phase. It can be a slow process, and that is completely normal. And we're there with you each step of the way. It is really important that we start slow and gentle to ensure that you heal and can slowly recover from your surgery and the side effects of medication and the time you've spent in bed. And that is totally normal. And that's why we help guide you through the process of getting stronger again. So following your time in hospital, we'll send you home with a home exercise program. But also we want to make sure that when you go home that you're strong enough to look after yourself, just do activities of daily life, helping with the washing, things like that. They're challenging tasks and they can kind of feel like exercise at first. So those functioning activities are a progression. Then with that home exercise program that we've given you, it could look like more walking for a bit further, or walking for a bit longer, or other activities, but just increasing time, duration, frequency, things like that. Then with medical clearance, we can progress your programs. So as you're safe to do so, we might add some body weight exercises. There's definitely restrictions at first. For example, in the first 4 to 6 weeks, not allowed to lift anything heavy, and there are individualised restrictions that your team may let you know, and we will guide you with that as well. People progress back and really get back to the things they love doing and living active lifestyles. One of the most common things that we get asked is it safe? And I think there's a big fear associated with returning to activity and exercise after such a big process and surgery and things like that, and that is completely understandable. And that's why we want to have more of these discussions, because I think the fear comes with not enough knowledge, and we want you to understand that we will guide you through what is safe at each stage. But more than anything, it is so important for your recovery and for your life and journey ahead that you are active and are on this journey to active lifestyle. If, unfortunately, you do not get back into that activity and exercise, you could find the journey quite extended and quite difficult. Things like just looking after yourself or looking after your children or playing with friends can be really difficult if we don't work hard at that beginning to get you back active and strong. You might find there are some side effects from this procedure and transplants: extra fatigue, feeling weak, even the side effects from medications and things like that. And without overcoming these challenges and getting you back into exercise and activity, you really feel those challenges even more. And I think we can see other health risks. You're still at risk of cardiovascular disease, adding weight, a lot of other health effects, especially your mental health. So it's really important holistically that we get you back active, because we don't want to go down the path where you become sedentary and it's just not worth it. Everyone is really different in their journey and experience, and we definitely have patients that are quite fearful of returning to activity and exercise purely because they want to protect the graft and they want to make sure that they stay well, and they don't want to risk any damage. And we can reassure you now that we will guide you step by step as it is safe to do so to continue to progress. And I think that with education and understanding that you know that it is safe and the benefits that come with physical activity, you will see that it is safe to do so, and then you'll be more confident to engage and trust us and push yourself that little bit further. There are definitely barriers in returning to physical activity and exercise. Transplant patient-specific barriers, for example, fatigue, weakness, pain, discomfort, fear. And then there's the everyday barriers that everyone encounters, whether it's motivation, time, what the weather's doing. And I think it's just so important that you are educated in knowing the benefits and understand how important it is to do so, but then also starting small. Anything is better than nothing, and it is just so important to get back active, and it will get easier. Before starting any new exercise or home exercise program, you must get medical clearance. So that's either from your transplant team or a medical professional. This is just to ensure that you're safe, don't progress beyond your means, and to make sure that we can guide you in the right direction. There are definitely some great online resources where transplant recipients can look for some exercise ideas and support, and that would be on the Transplant Australia website. There's some fantastic resources, and also on New South Wales Health website. There's some great advice and suggestions about getting healthy and where to start. Please don't hesitate to ask us any questions. We are so here to help you, support you, and we just want to get you back to what you love doing, and we want you to be active and loving sport and living a healthy lifestyle.